Firstly, Minister, it's been 8 months since I came into this House, and this is the first opportunity I've had to actually talk to you with regard to COVID-19. So I welcome you in here to listen to our submissions on the Government's response to COVID-19 and the Level 5 restrictions. I also want to start off by expressing my heartfelt condolences to the families of those who have died with COVID-19 and as a result of COVID-19. I appreciate it is always hard to lose a loved one or a relative, regardless of the cause or the circumstances. The suffering of those who have been bereaved during this pandemic has been amplified by the government policy, however, which has either prevented them from attending funerals and removal services completely or drastically curtailed the number of people allowed to attend these funerals and removal services. It is incredibly cruel to limit drastically or to deny altogether the right of people to celebrate and mourn the life of their loved one, and also to prevent people by law, with the threat of criminal sanction, to comfort one another in their time of grief and loss and sadness. First of all, can I ask the Minister, did we have a pandemic preparedness plan prior to 2020? Were Level 5 lockdowns, i.e. shutting down society, healthcare and the economy, and imprisoning people in their homes, part of any pre-existing pandemic preparedness plan? Can the Minister cite public health policy prior to this year stating that during a pandemic, every other aspect of public health should be ignored and subjugated with the sole aim of dealing with the pandemic? Relating to the number of deaths, can I ask the Minister to confirm the total number of deaths where COVID-19 was the sole or primary cause of death? Can the Minister confirm the number of cases reported as COVID-19 related deaths, some 1,948 now? How many of these deaths were suffered from a life-threatening comorbidity? Can the Minister provide the House with data pertaining to the average age of deaths of those that have died of COVID-19 as opposed to the average age of death of those that have died with COVID-19? How do these figures compare to the average life expectancy currently in Ireland? Can the Minister provide quantitative analysis of how many lives have been saved as a result of lockdown restrictions being imposed in an indiscriminate fashion on the general population? Can the Minister provide data justifying this Level 5 lockdown style approach and proving that a strategy of focused protection for those that are susceptible to the virus would not have been a more effective and have caused less collateral damage? Can the Minister provide a quantitative and qualitative analysis on the impact of lockdown restrictions on society, on the economy and on the health of the nation? Have NPHET analysed the effect of the restrictions versus the effect of COVID? Number of deaths is important, but so are life years lost. Where is that analysis? The public deserve to see it. The restrictions will have implications. Where are NPHET's public health going to be opened and transparent about the expected effects of the restrictions and show the public what they expect them to be? Both the direct health effects, missed appointments, mental health appointments, as well as the economic and related effects. The quality of messaging and leaks that are emanating from NPHET, the government and the media. We must do better on that. No one seems to be thinking what effect this is having on the mental health of the population. Why not? Messaging must be reviewed and leaks must be eliminated to protect the mental health of our people and the survival of our economy. Why do we need daily number announcements and press conferences? The daily drip feed only builds anxiety and a very unhealthy behaviour pattern amongst a large number of the population. What is the Living with COVID plan? The current one is not working. It has caused anxiety, uncertainty and a significant economic impact. The government needs to pick a series of measures and just stick with them for the long run, rather than the cycling of opening up and locking down, opening up and locking down. It's too much. People and the economy need certainty, and the constant changes of levels only increases anxiety. Will the restrictions being applied get rid of the virus faster or end the pandemic faster? It strikes me that the only realistic endgame to this is the vaccine solution. Speaking of the lauded press conference and coverage of the imminent vaccine by our friends in Pfizer, can we pin our hat onto that? Let's examine the data on this panacea. Out of the 43,000 trials participants, I understand that only 94 people were used in the independent evaluation of it. Can the Minister obtain data from Pfizer demonstrating that this vaccine will significantly reduce hospitalisations, ICU admissions and deaths caused by COVID-19? Additionally, can the Minister obtain data from Pfizer confirming the efficacy of the vaccine in immunocompromised, the elderly and the other at-risk groups? Minister, can you please clarify the number of cases that are announced each evening, if these cases are COVID-19 cases, which include asymptomatic numbers? Furthermore, can you provide a breakdown of how many of these cases are actually infectious at the time of testing? The CSO figures showed that in the first 9 months of the pandemic, there were 876 more deaths in 2019. The data also shows us the neglect of the HSE in dealing with our people in the residential care setting. This problem within care homes has not gone away. What lessons have we learned from the first lockdown? To make the same mistake going forward is unforgivable. The restrictions of these lockdowns won't have any impact on the delivery of a vaccine. Yet there is a message to the public that the better we behave, the quicker it would all be over. Government, NPHET and the HSE, you all need to tell the Irish people the truth on what they really mean by living with COVID. Thank you.